Hi, I'm Louis Rios, and I'm the ASERF Research Foundation president, and I'm excited to be here because we got a great topic to talk about. We're going to be talking about some new technology that we're incorporating into the Society and the Research Foundation, and I've got a great group of panelists here that are going to help me explain what we're up to. I've got Jeff Kenkel, who's the chairman of UT Southwestern Plastic Surgery, and he's been the society president in the past. Lou Strock, who is my Research Foundation president-elect, and again, Brad Calobrace, our researcher extraordinaire and new member of the Presidential Circle for the Research Foundation. So what we wanted to talk about right now is two data projects that that we've incorporated into the society as we're starting to move into the future. And it can be kind of confusing because they're two different data technologies that can work together. So one of them is the AND project, which is the Aesthetic Neural Network, has about 350 members from the society on it, where we gather data. And then we've just are starting to develop a patient and surgeon app, which we're going to kind of talk about today. And that's probably going to be rolled out here in the next few months. This physician and patient app, we're calling it the Aesthetic One app. And about a year ago, we had FDA hearings with breast implant patients who had a lot of concerns about breast implants. And so I think the society did a good job of kind of listening to their concerns and bringing those to the app. So can you explain a little bit about like what is in the app that actually addresses the concerns of these breast implant patients?
Sure. I think despite what we all think, I mean, we all are clearly patient advocates, and I think we learned in the 90s how important data is. I mean, I think it was one of the reasons that we were challenged back then. We just didn't have the data. So I think going forward, we've tried to do things as best we can with regard to data collection, but I think there's still somewhat of a disconnect. We've done a good job of collecting data and sharing it with each other, but I think that interface between the patient and the physician and the line of communication still has been somewhat of a barrier. So I think this app is going to be perhaps the glue that's going to allow that interface to really happen, and it can help the patient keep their implant information, which I think some patients are really good at. And things happen. I'm not very good at keeping things, and then ultimately, if they're lost, this will be a place where they could go get it right away, no problems. I think any details surrounding the operative procedure could certainly be housed in something like this. There could be communications from the physicians and the societies with regard to what's happening, if there's something that's happened with in breast implants and whatnot, that could be sent out. If we look at how we all disseminated information to our patients, I mean, we had to put together our own letter, somehow make sure that we had all the patients that were included in this database and push that out. I think this would be much simpler process for them. So I think it really will help the interface between the physician and the patient, and it'd be a resource for patients to learn more about their implants and any concerns that they have. And I think finally, it's going to be an opportunity to have a secure network where patients can communicate either via the app in written form or even send us pictures. Right now, I think many of us use our cell phones and whatnot, but we don't really catalog some of those pictures that we get from our patients or even the dialogue that we have. This would allow us through that app to make it part of the patient's medical record.
So, we've had some initial discussions with some of these breast implant advocacy groups, and we've kind of given them a demonstration of the app, and they've been thrilled with like a lot of the stuff that actually it's been, to them, it's like beyond what they thought we could do. So I think from the patient's point of view, we've done really good. But now, Lou, you're going to be the ASERF president, the Research Foundation president next year, right? And right. So the FDA recently has been having a lot of concerns about how breast implants are getting registered and sent back to the companies. So how do you think this app can actually address those concerns?
So I think it's an exciting time for the Aesthetic Society and ASERF. The app itself, I think it's going to facilitate gathering information in a very organized way that should be easy for all of us who are Aesthetic Society members. The first issue is that the app itself has a scanner for breast implants, which will greatly streamline and simplify the registration process. If you're a member of AN, then this app will also auto-populate the registration form with all the information needed for the form. Ultimately, what's being worked on as well is the ability for implant companies to handle the registration through a direct link, which would streamline all this even further. So the days of faxing these forms that are filled out by our OR staff or office staff hopefully will be a thing of the past, and this technology should help make this easier for everyone, both patients and us as their physicians.
Right, so I think the point here is that, let's say you have a patient in the operating room, their information's in the app, you can actually scan the label and the actual official implant form will show up. You just verify the information, and at some point here in the future we'll just be able to press a button, so we won't have to fax anything in. You know, one of the problems that the FDA was having too, you know, it wasn't that it was just missing forms, but it was illegible forms, you know, incorrect phone numbers, incorrect emails. Now this is going to come out as a typed, very clear form that the OR staff or the surgeon will review all the patient's information before it's sent to the, so I think that that's really going to help. All right, so Brad, you're on the Aesthetic Neural Network, right? Yeah. And so the Aesthetic Society developed this a few years ago. They actually spent quite a bit of money putting this together. There's probably about 300 members that are participating right now. And so as a member of the Aesthetic Neural Network, what do you see as an advantage of being on the network and utilizing the app?
Yeah, so you know, the Aesthetic One app for me is great because we're already part of the ANN. For that, which is just a technique by which it's sort of hooked to my computers with them, and they sort of collect data, and it's seamless for me. They're collecting all kinds of data about my patients.
And you're not having to enter anything.
I do nothing.
You don't have to enter anything, right?
I enter nothing. So as it relates to, especially when we think about tracking of implants, the ability for it to get that data in a very easy way. So for an AN member, it's the most seamless. So you ultimately, the system will auto-populate that app for it, and so it'll be much easier. Now we are part of NBIR now, and it's just challenging to get all those cases in and try to track it that way. You know how enthusiastic I am about us using our Aesthetic Society and as a way of going in on this app and being able to populate all of those implants. I think we're going to do it more reliably, more efficiently, because you know we miss things, we forget a day, and you don't want to do that. So I think it's going to be great for that. What I also like, what really happened, is the fact is you don't have to be an AN member to ultimately have this app, right? And I think that was really, really great. So, you know, and they still can get the scanner, and it's gonna be much easier still to just scan the implants coming in and put in some of the profile data for them, and then you have it there. So I think it's good for those that are part of the Aesthetic Society and part of AN, but also for those who aren't, can actually use this, because at the end of the day, it is gonna be that interface between the surgeon and the patient mostly, but also the ability potentially to notify the manufacturers and keep their data better as well. That becomes what's the magic about this application.
So I think, like in summary here, as far as that's concerned, is that if you're on the Aesthetic Neural Network, that network is kind of getting your information in a HIPAA compliant way, and then if you're on the app, it's actually making you a calendar and putting that information into your calendar. Totally. So when you go to the OR, it actually shows up in color codes that this is a breast augmentation case. So you can see your calendar, and you can just click on that and go directly to your patient, and then the scanner's there and it scans it for you, and then all the patient's information's auto-populated. So it really makes it easy if you're on the Aesthetic Neural Network.
Yeah, and you know what came out of the FDA hearings that were last year, you know, really was at the FDA, the two major things they wanted was us to do a better job and have patient decision aids for them, a better informed consent, and then a better way of monitoring and tracking implants with patients. That was one of the complaints of the patient advocacy groups, is that the data wasn't just all there. So I think anything we can do and make it the most seamless and the most accurate, it's going to go a long way towards satisfying both the FDA and those groups and the manufacturers about our ability to monitor and track implants.
So Jeff, kind of now stepping off of what Brad was saying, the Aesthetic One app has some communication tools that can help the patient, and maybe even with these types of issues. You think you can maybe talk a little bit about it?
Yeah, I think we've kind of alluded to some of those. I mean, first, just to create a secure line of communication with our patients is going to be incredible. I think we all worry about being compliant and these dialogues that we have with our patients outside of the network. So this will create a secure network, and that not only is it secure, but then it's also something that can be recorded and maintained. So a lot of times, whether it's via email or through texting, a lot of the communications that we have with our patients just aren't maintained, and I think this will allow that to be an important part of the medical record, because there's a lot of convenience with communicating. I mean, texting has taken over our life, and there's a lot of benefits to it, even with our patients. So I think that is going to be another important thing that we're going to be able to use through the app. And then I think lastly, just all the information that we have, the objective information that we have about our patients, the blood work, mammograms, ultrasounds, let's just say, consent forms, et cetera. I mean, that's all going to be on there. It's going to be easy to push that to our patients if that's something that they want. And again, it allows them to have better access to their own medical record to some degree.
So I think, that's kind of what the patient advocates were really asking for, and I think that the app is really going to even deliver above and beyond, with these communication tools. Now, Lou, again, you're going to be the ASERF president next year, so we're still going to be.
He's told you that a couple times.
I know. He keeps reminding you of that. Yes.
So we're going to still be facing these
I appreciate
issues,
the
right?
You
reminder.
still have a whole year of presidency. I just remind
10 months.
you.
10 months. 10 months. So
You're still on.
yeah. So Lou and I, since we're on the Research Foundation, obviously we look at this as well from the research point of view. So how do you think that the app can actually help in research? Because ASERF did contribute a little bit of money into the development of the app, so we could maybe use it that way as well.
So I think that part of the power of the app is in its ability to collect data, and there's a review of systems component that patients will fill out that's particularly valuable both at the time of their surgery and afterwards. So you're effectively gathering data in a prospective fashion that you can really follow the outcomes, particularly related to breast implant illness or any other issues we don't know about right now, where we have a very powerful database. And if you combine that with the retrospective data from Anne, there's all kinds of directions that we can go in terms of learning more about all of this in a very helpful way. Additionally, you've got survey capability that's always good for feedback from patients in terms of their experience, their outcomes. So again, this is a very powerful set of tools to facilitate communication between us and our patients. And I think it's a very exciting time for ASERF and the Aesthetic Society.
I agree, because especially, Brad, right, like with breast implant illness, right, we're still trying to gather information.
Yes.
And does this type of procedure work? And what's the percentage of certain types of symptoms that go away if patients remove their implants or if they remove their capsules, if a total capsulectomy helps better than just not even taking out we don't even have that. So I think
We have none of that data.
Yeah, so I think this is going to let us, don't you think this will probably
Yes,
help us
because
gather that information?
There's just so many databases you can go to and start looking at and start seeing trends. We just don't have that data right now.
So you like it. So how would
I
you
do.
summarize
Well,
this?
what I would summarize is that's why I became a presidential circle person was right now, because my interest was in breast health and breast research. And through ASERF and it's with the Aesthetic Society, to be able to earmark our dollars that we donate to certain things that we care about. And for me, of course, it's about breast implants, and especially at this time. And so for all of us who've been part of that, and ASERF presence right here, I think, I would just challenge for all Aesthetic Society or plastic surgeons to consider that as being one option for them, a great way to give either in their will or to give to the ASERF Foundation, because you can earmark it, and also it does something great for our profession. And what the FDA called us to do, we're actually doing it in a very effective way, in a very modern way, that delivers information in the way that we talk about and use information now. I think it's really, really great.
Yeah, so the way, and I'm a presidential circle donor, and so are you, and you will have to be too, Lou, in the
I'm aware of
future,
that.
right? But the way I look at it is plastic surgery's done a lot of great things for my life and for my patients, and so it definitely is a way to give back. And if you can earmark it for research like this, it's really done in a useful and positive way.
Agreed.
So we've had a little session here kind of going through some of the new technology that the society is developing. We've entered into a new era where we're starting to get rid of some of the paper, and we're going to start documenting things through apps and all sorts of different technology. what's really great about these projects is that we're really addressing our patients' concerns, we're addressing the FDA's concerns, but we're really promoting research, evidence-based research and practices, and we're enhancing our communications with our patients. And so I think we're really stepping into the right direction here, and I think that our patients are starting to realize that, the patient advocates. For anybody who's interested in joining the Aesthetic Neural Network, I mean, we would really appreciate you having you on the network. It's going to make it easier should breast implant registration become mandatory in the future for us to be able to use implants. It will really make it easier for you. So I encourage any Aesthetic Society member to please consider joining if you're able to. And I want to thank the Aesthetic Society for hosting this roundtable. Thanks again for having us here.